Very much. My question to you, Leader, is on the issue of malaria. For all the years that I have been here and before, I have worked on the issue of malaria in Africa and spent a lot of time in the villages in Africa. So I working to eradicate malaria forever from our continent. And I was very pleased that last spring the government made a $785 million investment towards malaria prevention on global funds. The Global Fund spends about half its resources to procure and purchase drugs and mosquito nets to prevent malaria. It's a goal to eradicate malaria completely by 2030. Senators, when I go to the villages, a $10 net saves 4 children's lives for 5 years. That's what we can do and constructively do. By increasing our funding for the malaria control, we strengthened efforts enabling health professionals in countries like Uganda, Nigeria, and Ghana take the required precautions for this disease. These actions also reduced Ebola from spreading by a significant amount. However, Leader, even with the funding that we've given to Global Fund, it still struggles on establishing emergency responses and long-term responses as more diseases break out around the world. My concern, Leader, is, and you may not have an answer today, and I respect that. My concern today is that as new terrible diseases come on, attack people, malaria will be forgotten. And so I would like, Leader, for you to tell us what are the government's plans to make sure that we do reach one day that our Earth is malaria-free.
Harder.
I thank the Honourable Senator for her question and her years-long commitment to eradicating malaria and other infectious diseases, particularly in Africa. The Honourable Senator will know that governments of Canada over the last number of years, really about 15 years, have consistently been part of the International Global Fund in this regard, and working with the private sector, particularly the Gates Foundation, with respect to malaria, tuberculosis, and AIDS. The Senate will know that last September, the Minister of International Development, along with the Prime Minister, hosted the 5th Global Fund Replenishment Conference, which raised a total of $12.9 billion US to end AIDS, tuberculosis, and malaria by 2030. AIDS and tuberculosis being included in the fight on malaria. Of the total of the global commitment, Canada pledged to invest $804 million over 3 years. That clearly goes a long way in continuing Canada's engagement in the abolition of malaria from the scourge of the earth. I would be happy to inquire further of the minister responsible whether there are further steps being contemplated in the next round of replenishment as it comes forward. As well, senators will know that not this year, but next year, Canada will host the G7, and it is in that context that much of the impetus for the Global Fund has taken place. And while I can't commit for the government, obviously, this is one area where Canada has historically, over the number of years, used the opportunity to encourage further efforts.
Senator Jaffer.
Leader, thank you very much for your answer. Leader, I always dream that one day we will not say malaria, polio, TB, Ebola, we will say one-stop shopping. In the village, when a child is, whether he has measles, smallpox, malaria, it doesn't matter. Mother can lose the child. So may I ask that you please discuss with the minister if we could now move to looking, it's not what disease you have, but we have a comprehensive small clinic in places, rather, because what happens is when I go to the villages and I have to sometimes say to the people working on the ground, this year is not malaria year. We will get no funds, maybe next year. It should not be that we choose between diseases. We should be looking at one comprehensive approach to deal with all diseases. And my worry is at G7, because the polio lobby is so strong, that we will again focus just on polio. So I urge you, Senator Harder, to look at a more comprehensive approach.
I'm happy to take that up with the minister responsible.